Here, I'm going to talk about some NCLEX tips or some most important topic for the NCLEX licensing exam. Just keyword and all of the information here related to the NCLEX board exam question. So in case of myasthenia gravis, it is worsen with exercise and improve with rest. So myasthenia gravis get worse when patient do the exercise, and when patient take rest, they feel better. In case of myasthenia crisis, we go for the test called Tensile Test. A positive reaction to the Tensile means improve the symptoms, and it means patient has myasthenia crisis. In case of cholinergic crisis, it is caused by excessive medication. So the priority, stop the medication and giving the Tensile will make it worse. Or in case of head injury, we give the medication called mannitol. Mannitol is an osmotic diuretic. It reduces cerebral edema. And mannitol crystallized at the room temperature, so always save in a filter needle. Priority to the liver biopsy, it is important to be aware of the lab result for prothrombin time. Right? Otherwise, bleeding tendency, it is the priorities. Stop the bleeding. So in case of diarrhea, means loose motion. So the loose motion through the anus. Patient develop metabolic acidosis. In case of vomitus, metabolic alkalosis. How we remember these two? Just remember anus. Anus means it is related to the diarrhea. It is metabolic acidosis. Vomitus means something came out through the mouth. Think about the mouth, metabolic alkalosis. Easy way to remember and answer the correct question with confidence in NCLEX board. In case of myasthenia or hypothyroidism, slow physical and mental function. Hypothyroidism, T3, T4 down, but TSS go up. Also sensitivity to cold, dry skin, and dry hair. In case of Graves' disease, means hyperthyroidism, T3, T4 up, TSS go down. So if patient have a Graves' disease or hyperthyroidism, accelerate the physical and mental function, hyperactivities, sensitive to the heat, fine and soft hair. Thyroid storm, increase the temperature, increase the pulse, and high blood pressure. After the surgery of thyroid tumor glands, we call post-thyroidectomy. It is good to maintain the patient position semipolar and also prevent the neck flexion or hyperextension. Also, teach at the bedside. In case of hypoparathyroidism, we have to check for convulsion. We give arrhythmia, we maintain and check for dysarrhythmia Also, tetany is more common, causes the spasm and stridor. So this is the sign symptom develop because of decrease the calcium, because patient has a hypoparathyroidism. So the treatment option, give them high calcium but low phosphorus diet. In case of hypoparathyroidism, easy way to remember CAT, CATS. C for convulsion is common, A for arrhythmia, T for tetanus. Involuntary muscle movement, tetanus, or muscle spasm and stridor. In case of hyperparathyroidism, fatigue, muscle weakness, and renal calculi. So in case of hyperparathyroidism, calcium level go up, parath hormone go up, and this excess calcium is precipitated in the kidney and causes the renal calculi. But phosphorus level go down. Patient complain back pain and joint pain because increase the calcium level. So management, give them low calcium but high phosphorus containing diet. Hypovolemia means volume go down, increase the temperature, rapid and weak pulses, increase the respiration, hypotension because volume go down, blood pressure go down, hypotension develop. Also anxiety, urine specific gravity should be go up because fluid is less, concentration go up. It is more than 1.030. In case of hypervolemia, we found rebound pulses, shortness of breath, dyspnea, and also added sound present in the lungs, right? Like crackles, also develop the peripheral edema because the problem is fluid overload. Hypertension, urine specific gravities go down because fluid go up, concentration go down, less than 1.010, and semipolar position should be good for them. So when ADH, antidiuretic hormone decrease, patient develop diabetic insipidus. When ADH means antidiuretic hormone go up, patient develop SIADH means syndrome of inappropriate antidiuretic hormone. But diabetic mellitus, problem of the insulin. But diabetes insipidus, problem or decrease ADH. Excessive urine output and patient feel the thirsty, dehydration, weakness, and we administer pitricin. In case of SIADH, we see the change in the level of consciousness, decrease the deep tendon reflexes, patient develop tachycardia or palpitation, nausea, vomiting, anorexia is more common, and admin declomycin or diuresis. In case of hypokalemia, we see the muscle weakness, potassium level go down in the blood. Patient present with muscle weakness or dysarrhythmias increase the give the food containing the vitamin K. So increase potassium-rich food. Potassium-containing food are raising banana, apricot, orange, beans, potatoes, carrots, and kale. When potassium level go up, we call hyperkalemia. Patient present with muscle weakness, urine, either oliguria or anuria, completely stop of urine or scanty amount of urine, respiratory depression, decrease the cardiac contractility, EKG changes, also reflexes change. Easy way to remember: murder, M-U-R-D-E-R. M for muscle weakness, U for urine oliguria or anuria, R for respiratory depression, D stand for decrease the cardiac contractility, E stand for EKG changes and reflex change as well. Hyponatremia. Patient present with nausea, muscle cramp, increase intracranial pressure, muscle twitching, convulsion, and osmotic diuretics we give them. Also fluid. Hyponatremia, sodium go down. Hypernatremia, sodium go up. Increase the temperature, weakness, disorientation, or delusion. Hypotension, tachycardia, increase the heart rate. Also, hypotonic solution is the choice of fluid. Hypocalcemia means calcium go down. Patient present with convulsion, arrhythmias, tetany, and spasm and stridor. Easy way to remember: CATS. C stand for convulsion, A stand for arrhythmia, and T stand for tetany, involuntary movement of muscle, and spasm or stridor. Hypocalcemia, the sign symptom is we call CATS. Same as hypoparathyroidism, sign symptom is CATS, convulsion, arrhythmias, tetany, spasm, and stridor. Easy way to remember. And next here, hypercalcemia. We see the muscle weakness, lack of coordination, abdominal pain, confusion, absence the tendon reflex, and also sedative effect on central nervous system. When calcium level go down, patient develop confusion, tendon reflex absent. Magnesium go down, hypomagnesemia, we found tremor, tetany, involuntary movement of muscle, seizure, dysarrhythmias, depression, confusion, dysphagia, and digital toxicity if patient take digoxin. In case of when patient develop hypermagnesemia, we see depress the central nervous system, hypotension, facial flushing, muscle weakness, absence of the deep tendon reflexes, and swallow respiration. In case of diabetes insipidus uncontrolled or complication of diabetes mellitus, we see the shallow respiration. It is called Kussmaul respiration. Edison disease, all is down. Steroid hormone secretion go down, reduce. We see hyponatremia, sodium go down, glucose go down, hypoglycemia, dark pigmentation, decrease the resistance to stress, easily fracture, alopecia, weight loss, GI disturbance. All is go down except potassium. Potassium level go up, hyperkalemia. So if my patient has a diabetic, it is important to adjust the sugar insulin level. In case of Cushing, means everything go up CUSS except potassium, hypokalemia. Sodium go up, hypernatremia, glucose go up, hyperglycemia, also prone to infection. So Cushing syndrome is an immunocompromised condition because steroid continuously go up, immunity just going to go down. So infection easily get you. Muscle wasting, weakness, edema develop, hypertension, hirsutism means excess hair growth in female. Also, moon fades, buffalo hump, more common sign of Cushing syndrome. Edisonian crisis, we see patient develop nausea and vomiting, confusion, abdominal pain, extreme weakness, hypoglycemia, dehydration, and also decreased blood pressure. Pheochromocytoma. So this is the complication because of the abnormal function of the medulla of suprarenal gland. Hypersecretion of epinephrine or norepinephrine. The effect of persistent hypertension, increase the heart rate, hyperglycemia, diaphoresis means sweating, tremor, also pounding heart rate, and also avoiding the stress because they have a very less control how to deal with the stress. Frequent bathing and rest breaks is important. Also avoid the cold and stimulating food or surgery to remove the tumor is a treatment option for the patient. Next is neuroleptic malignant syndrome. Neuroleptic malignant syndrome is a complication of few of antipsychotic medication. When patients have neuroleptic malignant syndrome, what are the signs? Right? We see hyperpyrexia, and patient feel to get hot and also stiff, increase the muscle tone, sweaty, diaphoresis means blood pressure go up, pulse pressure go up, and respiration go up. Also, patient start to drooling. So it is important to take the measurement to prevent the complication of antipsychotic drugs like neuroleptic malignant syndrome because it is the life-threatening condition.